Thank you for this opportunity to share our best practice clinical immersion framework, a pilot study. My name is Dr. Cindy King, and along with my colleagues, Dr. Bethany Slazowski, Dr. Denise Pope, and Dr. Deborah Wingfield, we came together in June of 2020 to look at an opportunity to address the immediate need to provide clinical experiences for nursing students due to COVID-19. For the last 4 decades, nursing literature has really highlighted the academic practice gap, and current literature suggests that little has changed despite efforts to address this gap. Further, the complexities in today's environment, specifically the COVID-19 pandemic, has really increased added pressures to graduate competent, practice-ready nurses. The American Association of Colleges of Nurses and the American Organization for Nursing Leadership have emphasized that practice academic partnerships are essential to addressing this need to fill this gap and to address different ways to look at how we can prepare nurses for the future. In response to this immediate need in June of 2020, Children's National, along with 3 nursing programs locally, Trinity Washington University, Howard University, and the Catholic University of America Conway Nursing School, came together to form the District of Columbia Practice Academic Gap, DCHA. The collaborative aimed to address the unmet need for clinical experience and provide academic credit to Bachelor's of Science nursing students who were already hired for the hospital's practice-based summer internship program. The collaborative resulted in the design and implementation of a pilot study that not only was able to evaluate the outcomes of student learning, but also come together to develop a framework, the best practice clinical immersion framework, using a shared clinical syllabus and a shared e-learning platform. As you'll see in the illustration, at the center of this framework is the pre-licensure student. The academic and practice partners collaborate to identify the learning needs of the pre-licensure student, understanding what they require for transition to practice, clinical skills, standards, and also looking at the professionalism opportunities for learning. Through the collaboration, the 3 universities came together, reviewed their current pediatric syllabi, and were able to come and form a single shared syllabus that was made available on a shared e-learning platform that was developed at Children's National called RN's Connect. All of the eligible students who participated completed the coursework requirements and were awarded 90 hours of clinical practice. Pre-post data using the Casey Fink survey, Readiness to Practice survey, showed significant improvements in communicating with patients, delegating tasks, feeling more comfortable documenting the electronic record, having more opportunities to practice skills and procedures, feeling more comfortable communicating and coordinating care, feeling simulations help them prepare for clinical practice, and being more comfortable in knowing what to do to care for the dying patient. Qualitative analysis showed 3 keywords that emerged: knowledge, confidence, and skills. We believe that this pilot and this innovative approach created a structure and process that enabled nursing students to not only receive clinical practice and academic credit, but it also emphasized the opportunity to develop work-study programs. Further, this best practice framework, we believe, can be easily adopted by other practice academic partners in all clinical areas. Thank you.